Greetings to each and everyone. I'm Al-Faheed and this is my brother Abdul Muiz Osman. And today, this is cluster 5, changing of patient gown with an IV fluid, starting an intravenous fluid infusion up until discontinuing the IV infusion. So first and foremost, good morning po sir. Ako po si Nurse Fahid. Kayo po ba si Mr. Osman?
Yes.
So sir, ako po ang maging nurse for today and papalitan ko po ang iyong damit, then later on papalitan ko po ang iyong IV infusion. Okay lang po ba sa inyo yun?
Yes.
Okay. So before everything else, make sure that you have prepared all of your materials and then start by wearing your personal protective equipment or by washing your hands. Okay. So first, we should assist the patient in removing the back of his gown. So sir, side po tayo. Then, untie the back of the gown. Okay. Then place patient back in the supine position. Then from the far side of the hand, without the intravenous fluid, try to remove the sleeve of the gown and assist the patient. Then go off to the far side and do the same technique. Now carefully slide up the gown through the tubing and make sure to remove uh, the IV fluid. Then after removing the gown, make sure to dispose of it and then grab a new pair of gown for the patient to use. So then do everything in reverse this time. So this time the gown should go through the IV tubing and up to the patient's arm. Then place the patient in a sideline position in order to tie the back ties. Then place patient in a supine position. So during the entire duration of that, make sure that you are always checking the patient's injection site as well as the flow of the dextrose. And that is all for changing a gown while the patient has an IV tubing. Now let's proceed to changing the IV tube and the container. So first, make sure that the clamp is closed. Then remove the empty container. Make sure that the container is always above the patient's head. Then, after you remove the cap of the new container, you also just remove it, then insert it with the twisting motion. Then start hanging it. Hmm. Make sure it is kept close. Then just pinch it until it reaches halfway. Then you can continue with the IV infusion. Now, since we're in this step, the previous things I mentioned can also be the step for starting an IV fluid. So, in priming an IV fluid, uh, make sure that the cap stays on, and then uh, turn on the IV tube. Make sure to check the drip rate. Make sure that there is no bubble left in the tube. And then once you make sure that there is no more bubbles, you can close the clamp. Then reinsert a sterile cap, and that is how you prime your IV. Now, in monitoring the IV infusion, of course, you should check the site of injection to see if there are any swelling first. Then monitor the drop rate of the IV fluid by the hour or minute by just counting how many drop it takes for 1 minute. And after the drop, of course, make sure to check the current fluid volume according to the doctor's order to see if the sufficient amount of fluid has been already infused with the patient. And if not, you can, some agencies would either just call the physician if not enough infusion, or if there is too much infusion, some agencies would allow you to manipulate how many drops per minute it has in order to get the recommended infusion time for the patient. And if there are any present swellings or abnormalities within the IV site, within the tubing, for example, fluid that has foreign fluid in the IV infusion, you should directly stop the IV infusion, then call the physician. Now, for discontinuing the infusion, make sure to, of course, expose and check the site, and then place waterproof linen under the patient's IV site injection. Then close the clamp. After closing, start by removing the dressing of the IV infusion. Make sure that you have counter traction in order to not remove the needle. make sure the needle is held in place. Then, using another stellar gauge, make sure do not press on it, but keep the needle still. And then, if you are going to pull the needle, make sure it is along the line of veins and do it slowly. Hmm. Afterwards, apply pressure for 2 to 3 minutes until the bleeding stops. And then, using tape and another sterile gauze, remove and replace it with a clean sterile gauze, and of course secure it with tape. If bleeding persists, you can place the hand of the patient into the heart level. And if there are any abnormalities, of course, you should notify the physician. And that is how you discontinue IV infusion. Now let's move on to administering oxygen. So for this one, since I could not get the tank, ito lang yung dadala ko. So imagine nyo lang mayroon tayo dito ang oxygen tank. So connect the flow meter to the oxygen tank, and then make sure that the humidifier has water, and according to the physician's order, monitor the oxygen flow rate. Then once it is connected, connected to the prescribed air tube. So in this one, the nasal cannula. So connect the nasal cannula through the flow meter. After it is connected, you can now turn on the oxygen. Then, if the flow rate is just on the physician's order, make sure to feel for the airflow if it is sufficient, and check the tubing for any holes, or just check it if there are any abnormalities within the tubing when you turn on the oxygen. Now, you want to start applying it to the patient. So, in the case of nasal cannula, first, you must fit the prongs of the nasal cannula to the patient's nose. Okay, and then loop it around the patient's ear. Okay, if it is not adjusted, you can pad it or tape it to the side in order to secure it, and then monitor patient for any signs of abnormalities if there are skin irritation, and of course check the equipment as you go. Now, in using the face mask, it's much simpler. So, first, make contact with the patient's nose, and then loop it around the patient's ears and secure. You can adjust the metal strip on the oxygen according to the contour of the patient's face. Then, similar to the nasal cannula, of course, check the tubing, and of course, assess the patient condition every 15 to 30 minutes for any signs of oxygen-related problems. For example, if the patient has dyspnea, of course, monitor the equipment too if there are any problems, because is a significant. This is significant in terms of airway and the delivery of oxygen to the patient. So that's it for the administration of oxygen.